Pregnant, carrying a breech baby, worried that you may have to do a C-section? Well, Dr. Neena Mansukhani, Senior Obstetrician and Gynecologist at Jahangir Hospital, is going to tell us why external cephalic version is relevant today. Over to you, ma'am.
Thank you. About 5% of you at 9 months will be carrying a baby that is breech. That means instead of the head occupying the lower pole of the uterus or the womb, the buttocks or the breech of the baby is actually occupying the lower uterine segment. In such cases, you have two options. One is a vaginal breech delivery, which is fraught with its own problems. The second is opting for an elective C-section. So here you have the third option, which is called as external cephalic version, where we actually flip the babe externally through the mother's tummy into a head down position, and then we have the alternative or the option to opt for a vaginal delivery.
But isn't it scary, and wouldn't the patient be worried?
Of course, it's worrisome when somebody tells you that they're going to flip your baby externally. But remember that our baby is well cushioned inside the mother's tummy, with mother's womb, in fact, with the mother's fat, the liquor level or the fluid surrounding the baby, the uterine muscle, and the amount of force used in this procedure is fairly moderate. So nobody is going to cause willful trauma to your baby. It is done in a very safe manner and over a time of about 5 to 10 minutes under ultrasound guidance, ensuring the well-being of the baby.
But how trained are, yes, doctors would be trained, but how common is this done?
Well, the uptake of an external cephalic version is definitely contestable, because it depends on what type of breech you have, the weight of the baby, the level of fluid around the baby, whether this is your first time or the second time that you're going for delivery. Or a lot of factors do determine the success of this procedure, and that is why women are scared to opt for it. But if properly performed in a setup which is adequately equipped with facilities to ensure the well-being of the baby and facilities to carry out an emergency C-section in the event of anything going wrong, I think this is a fairly safe procedure then.
Do you see an uptake in this, especially about the C-sections that you're talking about?
In the present scenario, with rising C-section rates, one has to resort to alternatives and do our best to reduce the rate of a primary C-section. Since 5% of these cases do present at term, one has an option of then resorting to this and reducing the C-section, which of course has its own problems and morbidities like excess blood loss and infections and the cost.
So finally, your advice to a pregnant woman who has a breech baby and can go in for an ECV procedure, she should do it.
Yes, I would say please use the option. If you have it and you are a suitable candidate for the same, use the option.